Now we will discuss about lateral wall of nose. This is lateral wall of nose. Here also same. First we have to see what are the bones which forms the lateral wall and what are the different features which are present in the lateral wall of nose. Blood supply, nerve supply. That we have to discuss. First, if we take lateral wall of nose, from anterior to posterior side, some bones will be forming the lateral wall of nose. Okay, that I cannot show you because I have to remove all these things. But remember one by one. From anterior to posterior side, nasal bone. Then here there will be one process which is extending up from the maxilla to attach to the or to articulate with the frontal bone. So frontal process of maxilla. Then lacrimal bone. Don't confuse. Nasal bone, frontal process of maxilla, lacrimal bone, then ethmoid bone. Labyrinthine of ethmoid. That labyrinthine of ethmoid will form the superior and middle concha. Superior concha and middle concha. Then after labyrinthine, there will be one plate descending down from the palate. Perpendicular plate of palatine bone. Perpendicular plate of palatine bone. Then medial pterygoid plate. Medial pterygoid plate. Along with these bones, there will be one separate bone which forms the inferior concha. That name itself inferior concha. Okay? Inferior concha. Recollect. Nasal bone, frontal process of maxilla, lacrimal bone, labyrinthine of ethmoid forms the superior and middle concha, and inferior concha. It is separate bone. Then perpendicular plate of palatine bone, medial pterygoid plate. So these are the bones which forms the lateral wall of nose. Then what are the different features? See here, self-like projections. See, this is one self-like projection, this is one self-like projection, this is another self-like projection. These self-like projections from the lateral wall, they will be projecting in towards the nasal cavity. That means if it is a lateral wall, from here there will be self-like projections are there. These self-like projections what we are calling concha. What are these? Concha. These concha are 3 in number. Superior concha, middle concha, inferior concha. You can see here. Superior concha, middle concha and inferior concha. Right? So, if you reflect the concha or if you remove the concha, there is a space below this concha. Those spaces what we are calling mediators. What are the mediators? So, if you remove the superior concha, this is superior mediators. If you remove the middle concha, below it middle mediators. If you remove the inferior concha, below it inferior mediators. Inferior concha, inferior mediators. Middle concha, middle mediators. Superior concha, superior mediators. Right? Now we'll see what are the features of inferior mediators. Here, yeah, very good. See here, I am reflecting the inferior concha. If I reflect the inferior concha, you can see the inferior mediators. So this is inferior mediators. Into the inferior mediators, only one feature we have to remember, that is nasolacrimal duct. Nasolacrimal duct will be opening into the inferior mediators. Okay. Let me show that. At the probe point here, you can see.
Lift it up once.
This is the opening of nasolacrimal. Opening of nasolacrimal. Okay. Of course, it will be guarded by valve of Hessner. So, this is the nasolacrimal duct opening. Right. So that's what. Whenever you are crying through the nasolacrimal duct, lacrimal fluid will be entering into the nasal cavity. You must be aware of it. When you are crying, tears will be entering into the nasal cavity and you will be removing and you will be wiping to the blood front. Is it? So that means there is a communication from the conjunctival sac to the nasal cavity through the nasolacrimal duct. That is about the inferior mediators. Then we will see middle mediators. This is the middle concha. I am reflecting this middle concha. As soon as if you remove or if you reflect the middle concha, here you can see the bulging. Is it alright? Bulging is visible. This bulging, what we are calling bulla ethmoidalis. What is this? Bulla ethmoidalis or ethmoidal bulla. Ethmoidal bulla, bulla ethmoidalis. Below this bulla ethmoidalis, you can see the semilunar or half moon shaped hiatus. Is it or not? This is hiatus semilunaris. This is hiatus semilunaris. This hiatus semilunaris is half moon shaped, right? And if you see anterior to the hiatus semilunaris, there will be infundibulum. That infundibulum will be connected with frontal air sinus. See, this is the frontal air sinus here. This is frontal bone. Within the frontal bone, there will be frontal air sinus. Frontal air sinus connected with the infundibulum by a duct. That duct, what we are calling frontonasal duct. Frontonasal duct. Indirectly, what I am telling? Frontal air sinus opening into the middle meatus. That means hiatus semilunaris. Frontal air sinus opening into the hiatus semilunaris through the frontonasal duct. That is one opening. Then behind the opening of frontonasal duct, there will be opening of anterior ethmoidal air sinus. Here, anterior ethmoidal air sinus opens. Right? Then there is one more. There is maxillary air sinus. Opening of maxillary air sinus. Then over the bulla ethmoidalis. Over the bulla ethmoidalis, here middle ethmoidal air sinus is open. That means how many openings are there? 4 openings. Frontal air sinus opening through the frontonasal duct into the infundibulum of hiatus semilunaris. Then anterior ethmoidal air sinus, maxillary air sinus, middle ethmoidal air sinus. And they may ask, what is bulla ethmoidalis? Bulla ethmoidalis is a projection into the lateral wall of nose. It is because of middle ethmoidal air sinus. How it has formed? It is because of middle ethmoidal air sinus. Middle ethmoidal air sinus will be projecting into the lateral wall. So that forms the bulla ethmoidalis. Okay. So over the bulla ethmoidalis, middle ethmoidal air sinus opening will be there. So that is about bulla ethmoidalis, hiatus semilunaris, and the openings of different air sinuses into the middle meatus. That is about middle meatus. Any difficulty? So here, what are the terminology you have to remember is frontal air sinus, frontonasal duct, infundibulum, bulla ethmoidalis, hiatus semilunaris, anterior ethmoidal air sinus, middle ethmoidal air sinus, maxillary air sinus. Okay. If you remember these words, you can easily form the sentence. Right? That is about middle meatus. Then if you see superior meatus, actually this is superior concha. We have removed this superior concha. If you remove this, here actually this very small portion is there. But imagine this is the superior meatus. In the posterior most part of the superior meatus, here you can see the depression. Here it is, depression is there. This depression, it is in relation with the sphenoid bone and ethmoid bone. So what we can call this sphenoethmoidal recess. So this recess, what we are calling sphenoethmoidal recess. Into the sphenoethmoidal recess, there will be opening of sphenoidal air sinus. Into the sphenoethmoidal recess, opening of sphenoidal air sinus. Okay. Then along with that, what is the air sinus which is remaining now? Everything over. Posterior. Very good. Posterior ethmoidal air sinus also opening into the superior meatus. So these are the different features which are present in the lateral wall of nose. Now we will discuss about the blood supply of lateral wall of nose. Any difficulty in the features of lateral wall? Then we are dividing like this, 4 quadrants. So in the anterior and superior part, anterior ethmoidal and posterior ethmoidal arteries. Okay, posterior and superior part, sphenopalatine artery. Posterior and inferior part, greater palatine artery. Then anterior and inferior part, supplied by facial artery. But what is the branch? It's a branch from the facial, but what is the branch? Alar branch of lateral nasal branch of facial artery. Alar branch of lateral nasal branch of facial artery. Okay, so that is the blood supply. Then nerve supply. Nerve supply is also almost same. Of course, this middle part, upper part, it will be supplied by olfactory bulbs. That means this is olfactory region. It is taking the sensation by olfactory receptors. Okay, because it is for the smell sensation. Then anterior and superior part, anterior ethmoidal nerve, and posterior and superior part. Here you have to tell me. There is a nasal branch. It is dividing into medial branch and lateral branch. One is supplying to the nasal septum, another is supplying to the lateral one. So posterior, superior, lateral nasal. Posterior, superior, lateral nasal. Okay. Then posterior and inferior part, what will be there? There will be, actually it's a greater palatine nerve, but some books they give anterior palatine nerve. Anterior palatine nerve. Anything is okay. Greater palatine or anterior palatine. Then anterior and inferior part supplied by, yes, same, anterior superior alveolar. It's a branch from the infraorbital nerve. Infraorbital nerve is branch from or continuation of maxillary. Okay. So this is a nerve supply.